Good morning, Rob. Good morning, John. Good morning, Bill.
Good morning, Bill.
Bill, your thoughts on Senate Bill 460, which deals with vaccination laws in West Virginia?
Sure, and I think Delegate Pushkin did a pretty good job of summarizing. Didn't catch all of the interview there, but it's been a long time coming. Or as far as each year with the push for vaccinations for religious and philosophical exemptions, and unfortunately this year it seems to have more momentum than ever before, and it's steadily increased over the last couple years. And basically, the only thing I can contribute this to is from COVID. With the mandatory vaccinations, or not mandatory, suggested vaccinations. Some people want to call them mandatory, suggested vaccinations. So that's the only reason I can think it's gotten so much of a push this year. And as Delegate said, there was a number of exemptions that was put out there yesterday. They all failed for lack of support. So it's Senate Bill 460 that's out there, and as far as I know, it's scheduled to be possibly brought to the floor today.
Yes, it's scheduled for third reading. I have the Senate schedule in front of me, and it is, I believe, the first thing of actual weight in terms of bills that have some weight behind them. It is scheduled first. Senator Joey Garcia, who's one of the few Democrats in the House out of Marion, offered an amendment to require reports on the number of students who and I should say the Senate, I think I said the House, who have an exemption, the number of students who go to the school, and the percentage of students who are unvaccinated. Is that information important in any way, Bill, in regards to tracking these things?
I think it would be important to have. Would it require some extra work? Yes. Many things, if we want data, it always requires extra work, but I'm not sure that's data that they want or want to be able to see because I think it's going to say, it's going to show which schools and counties are the vaccination rates are going to start falling. And West Virginia is immunization laws are one to be unmatched in this country. But now we're going to make the decision, our legislators are going to make the decision to take us one more step to one more area that West Virginia is not going to be number one in and excelling in. This is one of the very few things that West Virginia excels in, but we do this and we do this right. So in public health, this is our meat and potatoes here. We are out there providing vaccinations for these children to keep them safe. My concern is, the parents that have their children, they want to keep them safe. Maybe they're not old enough to get vaccinated. They're going to be exposed to children that their parents decided to not vaccinate.
Hey, Bill, do you know there's a tipping point in any vaccinated population? Obviously, if one person is not vaccinated, then there's not a danger to the group. Do you know statistically what is the tipping point of how many unvaccinated people, as a percentage?
Where's the danger point?
Yeah, at what point does it become a danger zone?
I'm not sure, John, to be able to give you an educated answer. Not sure. I think, we're going to lead to that point. Obviously, if this passes the Senate, and I know they're going in line with the governor's executive order that they want to get this passed, put it into law. But once it passes the Senate and goes over to the House side, and if it equally passes, we're going to start moving towards that tipping point, whatever it is.
I read in the measles outbreak in West Texas, the health official quoted said a drop from 95% to 93% in measles vaccination rates can spark an outbreak in a community.
In the COVID discussion, it was a much lower number. The tipping point was around 65 to 70% during the COVID discussion. But again, during that period, we didn't know what was going on.
Right.
It was a lot of
Bill, I believe some of the neighboring states around West Virginia allow for more generous exemptions. And when you talk to the politicians who are in favor of these exemptions, they're saying we're just bringing ourselves in line with neighboring states. Do you see outbreaks in neighboring states?
We see more than what we see in West Virginia, most definitely. And I believe, I'm not sure who mentioned it this morning, we do have, our country is seeing a lot of people coming in to live from foreign countries that still have these diseases that have not been eradicated like we have. And we're only going to potentially cause more danger to us. And in our neighboring states, and there are quite a few, because many of them wanted to look after West Virginia to tailor their immunization laws after, such as California. They wanted to look at what we were doing right. But there are a lot of states that they do not. They do allow for philosophical exemptions. They do allow for religious exemptions. And I'll go on the record. I'm an ordained minister. I don't find data that supports religious exemptions. In the past, absolutely. There's potential that you could look at what the vaccines were developed from. But what we have right now, there's no data to support religious exemptions as far as I know. I would love for somebody to tell me.
I'm concerned. I think it was, I could be making this up, but I think you were here in the studio when it was discussed that the polio, for example, that I was immunized against as a child with a sugar cube and later with a shot, is not the same polio that's out there today, which makes me vulnerable to a new strain.
Potentially, yes, if you're exposed to it. We do have a level of immunity that's in our system from when we were kids and received that on a sugar cube. I received it the same way. We do have that level of protection, which is better than what a child is going to be if their parents decide that they want to exempt them.
A couple of notes from our Facebook audience. Joe Ferretti, whose daughter is an ER physician. His daughter can relate many stories about unvaccinated folks coming into the ER begging his daughter to do something about an infliction that could have been addressed with a vaccine. It's one of the most frustrating aspects of her job. Nicole Sargent. I've worked in pediatrics for 24 years. In 2024, I saw 4 families with chicken pox for the first time in my career. These were infants, toddlers that by age were partially vaccinated. This is what happens when viral load overwhelms community immunity. Something I guess we're already seeing more of now, Bill.
Absolutely. And, I tell people time and time again, and our legislators do a great job. I'm appreciative of what they do. They have a tough job to do. They got to address a number of different areas for the couple months that they're in session, and areas that are not their expertise. But what I thoroughly encourage them to do is seek out information from the subject matter experts. We're not experts.
They don't believe them,
subject matter experts. No, I know they
don't. They don't believe them.
But it's these people that have surrendered their lives to protection of public health, the people that are protecting them in hospitals and your physicians. They need to reach out to them to get the real information.
Bill, on that note, we've got to go. I do appreciate very much you calling in this morning after your meeting.
Yes, sir. You all have a great day.
Thanks, Bill.